Frank believes that Frank's infection may have led to him developing delirium. He explains this to Kate. What were the delirium signs? 1. Frank's behavior had changed suddenly. 2. His daughter said it was out of the ordinary. 3. Frank had an infection. Frank begins to feel better as his delirium is treated. Medication is given to fight his infection, and Kate helps with his food and drink. Delirium causes a rapid change in the person's behavior. You may notice that they are confused, agitated, delusional or hallucinating, or tired or withdrawn. If you spot any of these signs and symptoms, or if you suspect delirium, please don't be afraid to tell someone. Together, we can make a delirium difference.
All right, that's an awesome video. I think it does a really great job of actually summing up what delirium is, what to look for, and yeah, I think it's really accessible to everyone. Okay, so for my article, I decided to read a piece by Wassenaar et al. It was titled "The Multinational Development and Validation of an Early Prediction Model for Delirium in ICU Patients." And the reason why the article was written was because there is one specific model that's actually in practice right now that can be used to kind of diagnose or detect delirium in suspected patients. And the thing is, like, it's a very valid and reliable model. The problem is that it requires that detection of these specific signs occur within the first 24 hours of the patient being admitted into the ICU. And the thing is that, if you miss them, or if they aren't, if you don't really know to look for them, of course you can. This model is then kind of rendered, unusable. And so because delirium is so important for healthcare professionals to detect it early, especially in high-risk patients, a study was done to try and see if there was a model that could be created that actually could be used throughout a patient's span or time span in the ICU. So rather than just the first 24 hours. So the study took place in 13 ICUs across 7 countries, and out of more than 5,000 initial patients, 2,914 patients were used for the study itself. Most of the patients were over the age of 60 years old. And some of the criteria that had to be met in order for them to be considered appropriate for the study was that they had to have not had any delirium detected at admission, and their stays were greater than 1 day. So at the end of the study, the researchers actually found 9 predictors that could be detected throughout the entire length of stay for these patients, and some of them were ones that we've actually mentioned before, such as age, or its history of alcohol use or substance use. And these also included pre-existing dementia, certain results within their BUN, which is a type of blood work, respiratory failure, and also the urgency in which the admission had to take place. So basically the status of admission. So this model was found to be highly reliable. It's very effective, And it was also found to be sufficiently valid. And one of the things to really point out with this model is that the predictive value actually improved significantly the longer they used this model. And so this, of course, is not just for physicians or PAs or nurses, but also all healthcare professionals who are dealing with these patients. So that also includes people within our own demographic as social workers and other caregivers and counselors. So there's several really great and comprehensive web resources that provide a lot of information, not only for healthcare professionals, but also patients and or family caregivers, that provides a lot of great information about dementia. I'm sorry, not dementia, delirium. And one of them is the American Delirium Society. And it can be accessed at americandeliriumsociety.org. One of the things that you'll also notice is that there's a society for just about every major developed country, whether it's Australasia. There's also one for the European Delirium Society. So there's a lot of good information out there. Another one is one called NIDUS, or NIDUS, at deliriumnetwork.org. And this was actually created out of the American Delirium Society. And the purpose of it was to basically act as a collaborative and multidisciplinary network that that's focused on delirium research in a very innovative and cutting edge way. So there's a lot of awesome information on there as well. And last but not least, there's also the ICU Delirium and Cognitive Impairment Study Group. And as I've mentioned throughout the presentation, delirium is often present in not only the ED, but the ICU. And so this gives very specific and pointed information on what to look for and certain markers of delirium. And this site actually is really interesting. It was started by the Vanderbilt University Medical Center and by the Center of Health Services Research. And they actually have this, it's called what they call a standard bundle. It's the ABCDEF standard bundle, and it's basically a collection of ICU measures. And A is for assess for and manage pain, then followed by both spontaneous awakening trials or spontaneous breathing trials, choice of sedation and pain reliever, delirium monitoring and management, which of course focuses on this disease we've been talking about, delirium, early mobility, and family engagement. So it's really comprehensive site. There's a lot of great resources that you can actually access there. And the American Delirium Society actually is where I found that video that we just watched. So these are all really reputable and really great resources. And in case you want more information, these are my references. And yeah, that's it. Thanks so much for watching, and I can't wait to see you guys' presentation as well.